Hello, Semester 2 students. Thank you for attending this pre-brief recording. I'm going to be going through your clinical placement book for mental health, and you can see that book that I now have on the screen. So this is placement 2 of 4. The reason that we've recorded this clinical pre-brief is because we've got students from starting the 31st of October right through to February that will be going out to clinical placement for mental health, and we found it probably a bit difficult to try and get you together for a face-to-face Zoom session. So we're going to be sending this recording out to all students, asking you to listen to it probably sooner, and then probably a week before you go out on clinical placement, just so you're familiar with the book and familiar with the scope of practice that you need to work in for the mental health placement. So you can see on screen your clinical placement mental health book. We need you to populate this book prior to going out in placement. So put your student ID in, your name, your group. Your group's very important. You need to know what group you are. You're either St Albans, Werribee or Sunshine, and your group number. The facility is where you're going to, and your placement dates are your dates from your start to your finish. So this should all be populated prior to going out on placement. Moving through each clinical book, and you would have seen this in semester 1, has the same preamble. So this is like the preamble, the first part of the book that you would already have a good understanding of. So I'm not going to go through this, but you need to read this and make sure that you're familiar with it. As I said, it was in semester 1's clinical book. It'll be in 2, which is this is semester 2, 3 and 4. So just reading that, I'm scrolling through and I'm at the table of contents. Again, this is stock standard, and the only thing that will change is where you're seeing the units that are being delivered that you would have been deemed as satisfactory to move on to placement. So we've got HLT NN008, POO 003, N009, N012 and DIV 001. So those units are the units that you would have undertaken in semester 2. They're also the units that you need to achieve competency on clinical placement. And again, if this was book 1, aged care, it would have the units that relate to that semester. So scrolling through again, the contact list. So these are my contact details. If you need to ring me, my number is not extension 2118, it is extension 2031. This is the clinical mobile number. So you can use this clinical mobile number for emergency purposes. I don't want to be rung on the weekend to say you're not attending clinical placement. You need to send an email to the facility, to your facilitator, to Susan and the clinical team, and CC myself. This number is for the facility, the facilitators, and for emergency purposes only, not for students to ring me up to say they're not well, they're not coming into placement. These are the placement office buildings. So we're located at St Albans, which is the main campus where the clinical team are located. And we do have Werribee campus 1A160, where we've got Anne Carris office, which is situated, and I do have a desk there that we can set up the meeting times. Phone numbers you need to remember. So this is your facility contact. So wherever facility you are, what's their contact details? If they've got a unit or a ward, what's the direct number? And this is your clinical supervisor's number. So they should provide you with a mobile and their email where you can contact them for emergency situations, or to let them know that you're not coming in, or quite possibly that you could be late for some reason. Again, this introduction, clinical placement and assessment overview, this is exactly like book 1, 2, 3 and 4. So making sure that you're working within your standards of practice within the NMBA of 2016, and making sure that you understand the requirements within that semester's placement. So I'm just going to scroll through this and we're going to look at the clinical placement outcomes of attendance of 100%. So you have to attend 100% of clinical placement. If you did aged care, you would have done 40 hours by 2, which is 80. And on mental health, it's 40 hours by 2 weeks, which is 80. If you are sick for one day, you have to then contact the facility, the facilitator, the clinical team and myself, and you will have to provide us with a medical certificate. If you are absent for more than 3 days, you'll be deemed as not yet competent, and this placement will require, or those days off will require a medical certificate, but it may be insufficient time for you to achieve and be assessed on all the competencies. So please be aware that you could be deemed as not satisfactory and you'll have to redo the clinical placement. Again, that's an individual student by student basis. And we're just saying to you, any more than 3 days, you may be deemed as not satisfactory, but any absences require a medical certificate to be sent to us on the same day, not 2 days or 3 days later. The returning of the clinical book usually happens within 5 working days. However, we understand that there are public holidays, Christmas and New Year's that's coming up. So Susan from the clinical team will be advising students of when you can bring your books in for signing. So ensuring that you keep it in a safe place and that you don't damage your book or don't spill anything on it. It needs to be the same book that I gave you that is signed that comes back to me. If it's stuck together or waterlogged or damaged, then you may find yourself having to replace that book and getting all those signatures again, which is a big task. So you've got to work within your scope of practice. You are semester 2 mental health. Everything that you did in semester 1, or your ADL care, so your grooming, your feeding, your showering, your dressing, your documentation, all your legal requirements, your mobility, assisting with mobility, everything that you did in semester 1 needs to be brought forward into semester 2. This is a mental health placement, but you will be required to do all those ADL skills. You are not just there to observe for mental health. So that is your scope of practice. So ensuring you remain within your scope of practice is very important. You cannot administer medications. You cannot follow around a medication nurse. You need to stay within your scope. If you work out of your scope, you may be deemed as not satisfactory and you may be removed from the placement. This pre-placement mandatory skills assessment, so you can now date and sign this, your portion where it says student, if you're happy to do that now, and then I will complete the lab teacher course coordinators portion when you bring your books back for final signing. Attendance is 8 hours. Your 0.5 is your meal break. So your book will on your attendance show 8 hours of shift. So you need to do a total number of 400 clinical hours within the Diploma of Nursing program. That's a minimum requirement of 400 hours. If you are absent for a day, public holiday or sick, those hours will then be put on what's called Make-up Bank. And those hours, once totaled, when you finish your consolidation hours, will be totaled up and you will be placed at another facility to undertake those absence of hours. Again, everyone's individual with absence of hours, but if you're sick, those hours will just continue to add on through the semesters until you've finished your consolidation, and then you'll be provided with a clinical placement to undertake them to complete the minimal 400 hours which are required. This is your attendance record. So it's pretty self-explanatory, and just like aged care, your date, your facility name goes here, your start time, if it's the morning, it's 0700, your finish time will be 15:30. So we're working in a 24-hour clock. Hours per shift, there'll be 8, and your 0.5 will be a half an hour break. The supervisor then prints their name, his or her name, and then they will sign it. This is not to be pre-filled out. It's to be done on a shift by shift basis. If there is a public holiday, you'll put the date and time, the name of the facility, put public holiday, and there'll be 000, and then the clinical teacher can sign that off. At the end of your 2 weeks, your hours should add up to, if there was no public holidays and if you weren't sick, add up to 80 hours. Your facilitator at the end of week 2 will then sign off. Was there any days absence? Yes or no? And was there a medical certificate provided? They'll continue on by signing off here, supervised signature and name, and you will put your name up the top and your student number. This VU educator is me when your book is returned back, and I'm to officially sign it off. These are your list of orientation sheets. So when you go on to orientation day 1, you will need to do a walk around of the facility and making sure you understand where all these points of interest can be found. So you'll need to tick that and any comments that you need to add on. And then any additional notes that need to be added on here. Like if there is an evacuation point, you might want to note that down where it is. Student signature and your clinical supervisor signature, and the date is required when that's completed. Essential skills, as it says here, below is a table of summary skills linked to the units in semester 1 and 2. You are to ensure that you do semester 1 and 2 skills and provide the understanding and demonstrate those skills to your clinical teacher to be deemed as satisfactory for mental health placement. If we move on to the next page, you can see this is set out in a bar graph format where everything highlighted in yellow is what you can do. So administration documentation, bedside documentation, glucose monitoring, etc., etc. You will see here that medications cannot be given. So oral medication administration, it's not ticked and it's not highlighted. It's a semester 3 and a semester 4 skill. So again, anything which is not ticked, if you do that, you'll be out of your scope of practice and will be deemed as not satisfactory on your placement. So stay within your scope of practice. So you also have objectives that you will need to do. So there are 3 in each week. So this is objective 1, week 1. So on orientation day, sit down with your clinical teacher and write some relevant goals. I think we're past writing, do vital signs and make beds. You need to think about the placement that you are on and the units that you are undertaking. So find out what a good goal would be, how you're going to achieve it. Did you achieve it? What did you learn, and how can I further my learning or understanding? So there is another one, so objective 2 in week 1 and objective 3 in week 1. These need to be completed on orientation day. Your clinical supervisor will sign it off and date it. And then week 2, you have the same thing. What is another relative good solid goals for week 2 that you can achieve? So there's 3 there. So your last one will be 6. And then they get signed off again. Standards of practice as an enrolled nurse. Again, this is a preamble that's exactly like book 1, 2, 3, and 4. So read through that. If you've got any questions, you can email me with a question. But this is ensuring that you understand the guidelines that you're working and the rating of standards for your evaluated outcome. So you must attain a satisfactory result in all 3 domains for practice. So we've got 3 domains. The standards for practice is 1 to 10, and you must be satisfactory. So we're looking at this area here, requires supervision. So this is what all your domains should be graded as. And if we look at this, second placement requires supervision. Your first placement requires supervision, requires development, and requires development. These developments should now be requires supervision to be able to be deemed as satisfactory. If we look at these domains, you can read through them. They're exactly the same on semester 1, 2, 3, and 4's books. You need to achieve a yes rating or a not applicable. If it was not applicable on that placement, the clinical teacher can put NA. So all these domains and all these standards are exactly the same, and they are linked and mapped to those units that you have undertaken in semester 2. Overall rating needs to be S here, and then your clinical supervisor will sign it off, and you will sign it off, and then I will sign it off when your book is returned. These to go into domain 2, provision of care, it's exactly the same thing. Then we've got standard 5 and standard 6 and standard 7. What was your rating? We need to have an S here. If the rating was not satisfactory, your clinical teacher would have contacted me, and I probably would have come out to the facility and had a discussion as to why you're not reaching these domains. Again, we're moving on to domain 3, reflective practice. These are standards 8 and 9, and again, they need to achieve a yes rating or not applicable to be passed. An S there for satisfactory. They're your domains. At the end of week 1, you should have a meeting with your clinical supervisor, a formative feedback meeting, which outlines how you've been going in week 1 and any areas that you might need to work on or address. So this is your formative feedback, and this is your self-evaluation of week 1. At the end of week 2, you will have the same thing, but it's a summative feedback. So it's your final feedback of how you went during the 2 weeks and your self-evaluation of the 2 weeks. If you were required to go on a learning contract, which was identified in week 1, then the clinical teacher would have to note that in this additional placement requirement. So if we start at the top, clinical placement minimum evaluation rating, is that attained? Yes, that means that you have satisfied all the domains. Performance evidence records, were they completed? Yes or no? Now you will find in maybe semester 3 and semester 4 that there are components that may be incomplete. I'll talk about those within that semester, but there should be probably all of them that are able to be attained in your mental health placement. Additional placement requirements, learning plans, if there was none, they tick no. Reflective journal, was it completed? Debrief, participation and clinical skills records. So hopefully no learning plans, but the rest of these would tick yes. This is your final outcome and you want a satisfactory outcome. If you're not satisfactory, you should be well aware of this at the end of week 1 and how you are progressing at week 2. Clinical supervisor will sign this off and you will sign this off. I will sign this off when your book comes back to me. This is your final outcome. So make sure that you are checking that all signatures have been attained by your clinical supervisor. If you return a book and there are signatures missing, I will send your book back to you, or you'll take your book back to you, and you'll have to track down your clinical facilitator to sign where he or she have missed signatures. It's very important. Check your book for every single signature in that the clinical supervisor has signed it, because sometimes they do miss it. So it's your job now, before you walk out on your final day, that all signatures have been attained. Learning contract if you need to go on one. So if you are deemed as having difficulties or not demonstrating skills, they may put you on a learning contract in the first week. It also is not just around skills, but it's behaviours as well. And your clinical teacher will contact me and they'll provide you with feedback on how you can improve these skills in the following week, in your last week. So this says, has the student been placed on a learning contract, yes or no? Has the student been notified of their performance? So again, they will tick all this. They'll provide you with a follow-up meeting date and time, and they will give you a date and time of when you need to demonstrate the lack of knowledge or the deficit in knowledge that was identified in week 1. Now, if you identified that and demonstrated you have a better understanding, you quite possibly, and it's up to the clinical teacher, be deemed as satisfactory. If you have not been able to demonstrate the skills or the knowledge within week 2, you may be deemed as not satisfactory. So again, it's a learning contract between your clinical teacher and yourself. You need to work together and you need to demonstrate that you have learnt the skill or demonstrated a thorough knowledge within the scope of practice of semester 2 mental health. So if it is a learning contract, the issues will be identified here. There's additional space on the next page to elaborate if it's required. Clinical performance actions and objectives. So if the clinical supervisor deems you as not satisfactory in week 1, they need to provide actions and objectives where you need to reach those actions on a contractual time. They'll also sign it and you will sign it too. This is your clinical learning outcome. If it's been met satisfactorily in the second week, they'll tick this, or if it's not, it will be deemed as not satisfactory and you will not be passing clinical placement. This says the learning contract continued. If you need further elaboration or a bit more in depth, they can provide that information for you. And we've got the clinical health assessments and units of competency performance evidence records. So as I said to you, each semester have units that fall under it, and you need to not only in theoretical on campus during your theoretical sessions deem competency, you must also produce that skill and demonstrate that skill on placement. So as I said to you, the evidence is around the units DIV 001, POO 003, NN 008, NN 009, NN 012, WHS 006 and BSB Med. So all of those is what you are going to be assessed on and demonstrate your knowledge. So moving forward, each one of those units, as you can see here, HLT, NN 008, legal and ethical, you've got to be able to, on your workplace clinical placement, demonstrate a thorough involvement in two specific documented situations. So ability to work within the legal and ethical parameters that apply to professional nursing practice. Again, if you don't know what this is asking you, have a meeting with your clinical teacher, get them to assist you in a situation, two situations where you can be deemed as satisfactory. Again, they need to sign it, you sign it. When your book comes back, I sign as VU educator. Same with BSB Meds. You've got to understand medical terminology. So your supervisor, clinical supervisor, will be using medical terminology, and you need to be able to understand what they're talking about and also be able to communicate back using medical terminology. And they'll deem you as satisfactory or not satisfactory. Personal work stresses, which is S006. You need to also look at two situations. Again, your clinical teacher can help you with that within the placement setting that you are working in. We move through to the next unit, which is POO 003, which is analysed health information for at least 6 different clients presenting with different conditions. Now, you're doing mental health, and mental health does come under a chronic condition, but there are many people with other comorbidities within those facilities, especially within aged care. They have significant comorbidities. Look at their other conditions. Look at the ones that are in mental health facilities. Do they have any other comorbidities? So again, if you're unsure, take your clinical teacher, get a couple of files and start reviewing files with them and gaining a better understanding of what your clients are presenting with. Again, this is dated and signed, satisfactory, not satisfactory. And then you have a mini state examination. So this will need to be done. So you can see you've got patient XX or XY, male or female. We don't identify them as names. We can use their date of birth. And you'll need to fill out all these findings or observations. So if you're unsure, the clinical teacher will support you in this. So just scrolling through here, this mini mental is also extending on orientation and thought, other thought disorders, judgment and insight. So this will be one patient, client, resident, and then you have a care plan for that patient, client, resident that you just did the mini mental on. So this is a nursing diagnosis. So there are 5 boxes here. Think about putting 1, 2, 3 actuals, which will have related to and manifested by, and 2 potentials or risks of. Each risk of or potential will only have a related to. It will not have a manifested by because it has not occurred yet. Each has a goal. So make sure this goal is really specific to this nursing diagnosis. So you'll have 3 goals and 2 goals for the risks, 1 for this one and 1 for this one. Interventions, make sure these interventions will assist your client with whatever this problem is. Don't just put do vital signs, make beds, assist with feeding. That is something that will not specifically help your client or your patient. Be very specific about your nursing interventions. Think about, if I was a nurse coming on shift, taking over your rounds, how would I know what to do if you just put vital signs? So you need to be very specific about your interventions and what you want to do. Rationale is why you're doing something. So you should have probably 3 good rationales for each of these 5 that are here. Evaluation is, did it work? If your evaluation states that it didn't work, then this is where your variation comes into. You can change your interventions to improve better outcomes for your patient in relation to your nursing diagnosis. So again, this is clinical placement 2, this is patient 2. So again, you've got another mini state examination, exactly like the first one, and you have another care plan, which will have another 5 nursing diagnoses, 3 actual, 2 potential. You'll have 5 different goals and you'll have really good nursing interventions, not just one, at least list 3 or 4 good nursing interventions for this nursing diagnosis. Rationales I talked about, evaluation, how did you know that it worked, and variation is if there needs to be any changes. This is 009, this is mental health unit. So again, read what the performance or the assessment evidence requirements are. So we're looking at reaching a conclusion of a possible nursing interventions appropriate to mental health conditions of 2 people in the workplace and planned and evaluated care. So this could help you develop your care plans as well. So again, patient 1 and patient 2, work with your facilitator, your clinical teacher to reach these conclusions. Then we're moving on to 012 chronic health. As I said to you, some of these or most of these people within the aged care facilities will have comorbidities, which means lots of diagnoses or underlying chronic health conditions. So this should be fairly easy to source. If you're in a mental health facility, they too might have other significant comorbidities. So making sure you understand their history and looking at their documentation. Student reflection. So we're asking you to reflect on your own perspective on social and cultural diversity. So this is a self-reflection. Read what this is saying, self-reflection for students, thinking about the significance of culture within a healthcare environment. So look at these questions. How do you think you could reflect on these questions and make a reflection on the 2 weeks that you are there? This is Div 001, so this is diverse and social cultural backgrounds. So again, look at different cultural backgrounds. If you're in a nursing home, there would be many different cultural backgrounds. If you're in a mental health facility, you may not see a lot of them, but again, work with your clinical teacher and they should be able to help you complete this. So this is journaling. So we ask that students do reflection on week 1 and on week 2, and this will be checked by the clinical teacher at the end of week 1 when you're doing your formative assessment. So we're looking on reflecting on how completion of different learning objectives has contributed to the improvement of your nursing practice. Think about what you did in the labs. Think about what you did in the face-to-face theories. How did being on clinical placement and taking on what you did within the campus, how did that reflect or how did that change or contribute to the ways that you are nursing on placement? So you have week 1 and week 2 to do reflections, which need to be signed off by your clinical teacher. This clinical makeup and attendance and evaluation, you won't need to complete this because your makeup hours are done at the end of completion of consolidation. So you won't be completing this at all. Then there's just an appendices for you to look at and just general expectations. Now, I need to also reiterate that you are to wear full scrub uniform unless directed by the facility. Very limited jewellery, nothing dangling, nothing chunky, no big diamond rings, because think of skin tears and, you know, showering and all those sorts of things. You're to wear correct footwear as well, and making sure that you have your watch if you're doing vital signs with a second hand. You need to wear what you're wearing in the labs, taking forward into clinical placement. So anyone that's not dressed appropriately, hair's not tied back or correct attire, will be asked to leave by the clinical teacher, and that will be a day that you are down because you just can't go home and come back. So just be aware of your uniform requirements. These general expectations, you will see at the top of it is anatomy, physiology, pathophysiology, and disease processes, even vital signs. If you are a bit rusty on this, go back and review this, because your assessments are based on a lot of these general expectations that you have demonstrated in class or demonstrated in the labs. Mental health expectations. So again, with Helen Chandler teaching the mental health unit, you need to making sure you have a good understanding under the direction of a registered nurse, all of these tasks that have been, that are to be carried out. Again, the clinical teacher is your main source, so get that person to sit down with you and help you understand this better if you don't understand what the requirements are. Making sure that you understand your work within your scope of practice is what this is demonstrating. So I ask you to read through this and understand all of this prior to going out, and that if you've got any questions, you can email me and I'll get back to you as soon as I can. I'm just going to scroll down to the very last page. This page here is your submission of clinical placement book. I need this pre-filled out. So before you come in and see me, fill out your name and your number. This will stop the time that you sit at the table while I'm trying to fill out other things. You've got to do this. So fill all this out. The date here will be the date that you come in. We can do that when you come in. And here it says, I have agreed, I have made a fully bound copy of my placement book and had it certified by an authorised person. When you sign this, you agree that you have done this. If you're going to take screenshots of your book, I cannot certify screenshots. You should be responsible for your own work and should be proud of your own work. All your clinical books may be required if you're going to go for a graduate program. They may want to see what you've undertaken. If you're going to go for a job, they may see what you've undertaken. The hospital may want to look at the hours that have been completed, any reason. So making sure you take a full copy, it doesn't have to be bound, but a full copy of your clinical placement book so I can certify it. I will date it when it comes in, and you will need to sign it. And this needs to be pre-filled as well. Your group, student number, the date will be the date you come in, and your student name. Type of placement is mental health, and placement hours. If you've done the full 2 weeks, it'll be 80. If you're missing hours, then whatever your attendance adds up to. Then I will sign and date this section here, and I will rip off this bottom section and hand it to you, and it will go in your copy of your mental health placement book. So basically, that is your placement 2 of 4 for mental health. I just need you to remember, if you're going to be, if there's a sick day, you need to contact the clinical office, CC myself, your facilitator of the facility, to let them know that you're coming in. If you are running late, it depends how late you are. You just can't rock up to a facility at 11 o'clock and start a morning shift. It's best that you don't come in, and you'll need to make up those 8 hours. So, you know, please stay well and stay healthy as possible. Abide by the rules and the regulations within the facility. If they're requiring you to do a COVID test prior to attending, then make sure that you attend the facility at least 15 minutes earlier than your start time to get through all that COVID testing. Please also be aware that masks will be required on a lot of facilities. So whatever their requirements are, you need to follow that. If you've got any queries, go back to the clinical teacher or come back to myself or the clinical team that could assist you. So that's the debriefing, pre-debriefing for mental health. Again, if there's any issues, keep on top of it, get in contact with us and let us know what's going on. Otherwise, have a fantastic mental health placement, and we look forward to seeing you in semester 3, which is IV Meds. Thank you.